Let's get some analysis from the director of the Harvard Global Health Institute, Dr. Ashish Jha. We're also joined by Dr. Chris Murray. He leads a team of coronavirus modelers over at the University of Washington. Thanks to both of you for joining us. And Dr. Murray, your new model, which I've now gone through, projects more than 200,000 Americans will die from coronavirus by November 1st, unless almost everyone starts wearing face masks. So what factors contribute to this staggering new figure? 131,000 Americans have died from coronavirus over the past 4 months.
Well, we've got the upsurge in the states that you've been talking about, the hotspot states. We're also seeing it spread into places like South Carolina. So it's not just Florida, Arizona, Texas, and California. We're seeing disturbing upticks in even places like Ohio. And then you combine that with schools opening, seasonality, and that's where you get this sort of constant death rate that will continue through to November. But of course, we can do something about it, which is what you were mentioning on masks.
Because your model estimates, and correct me if I'm wrong, about 45,000 Americans, their lives will be spared if almost everyone in the country starts wearing masks when they're supposed to wear masks. We're talking about 45,000 Americans. So what do you say to people, even in spite of that, who refuse to wear a mask, which is so simple?
Well, it's an incredibly simple strategy and intervention. It's one that will save lives, but it'll also help the economy enormously because it'll avoid shutdowns that will inevitably come when things get completely out of control in some states.
And if people don't wear masks as they should, you also report in this new forecast that the actual number of Americans dying by November 1st would be anywhere from 186,000 to 244,000. How worried should we? 200,000 is bad enough, but 244,000 is a projection that is potentially out there. Is that right, Dr. Murray?
Yes, as you forecast farther out, of course, the range of what's possible becomes wider and wider, and certainly things can be worse than that 208,000 figure that is our best estimate.
Yeah, it could be another 100,000 Americans could die by November, worst case estimate. Dr. Jha, when you hear all of this, beyond wearing masks, what meaningful steps do American officials and citizens need to take right now to avoid losing more than 200,000 Americans by November 1st?
Yeah, Wolf, so thanks for having me on. And look, I think it's pretty clear what needs to be done. We are at a perilous moment in our country where large outbreaks are happening in large parts of the country, as Dr. Murray said, not just in those 4 states. And we absolutely need a national approach to wearing masks. I think there should be a national masking law, or certainly every state should pass one. But then beyond that, we really have to look at our indoor spaces. I don't think we can afford to have bars and nightclubs open. Restaurants may not be a possibility. And, on the issue of schools, the question isn't, can you open schools? Everybody wants open schools in the fall. The question is, can we keep them open? And the way that we're going and the way we're acting as a country, we don't seem like we're serious about keeping schools open this fall.
Well, what do you think about that, Dr. Murray? The impact potentially of reopening schools all across the country next month?
Look, if we, like Dr. Jha said there, if we can't get people wearing masks and avoiding large group gatherings, which is another huge, easy to address risk, then it's exactly what he said, which is we will end up opening schools. I have an 8-year-old. We want schools open. But what will happen is we'll have to shut them again when things get worse and transmission gets worse as the winter season comes on us. So it's in our hands how long we can keep the schools open. And it really depends on everybody to do what they can to really cut transmission.
And Dr. Jha, in addition to, wearing masks, social distancing, making sure you wash your hands, there's got to be a lot more testing and a lot more contact tracing. Explain that to our viewers right now.
Yeah, so Wolf, we've been talking about this for a while, and we've been hearing from the White House that we have plenty of tests, and yet we're seeing lines of people standing 4-6 hours to get a test. Look, tests aren't magical. But what they do is they help you identify who's infected, and then you apply contact tracing to identify who they might have infected. and you help people isolate in a way that they don't then infect others, that's how you break this cycle. And it unto itself isn't going to be enough, but combine it with masks, combine it with social distancing, and we really can bring these outbreaks under control if we decide that that's important. But we just aren't getting the kind of leadership we need to move forward in that direction.
We need national leadership right now. A lot of other countries that have done much better in this, they've had a national policy and not just local state or cities doing what they're doing. And Dr. Murray, you also argue that just because the U.S. didn't see a clear ending to the first wave of this virus, that does not necessarily mean there will not be a significant surge in the fall. You're really worried about that. Tell us why.
Well, we've looked at the historical pattern of COVID transmission. We've seen that it's related to season or temperature. And so that relationship is actually pretty strong. It also fits what we know about the first SARS epidemic. And so we're pretty sure that the potential, the drive for transmission will go up. It'll get progressively worse from September right through to a peak in February. So that makes us very concerned that the period after November 1st will probably be worse than even leading up to November 1st.
Yeah, that is so worrisome. And Dr. Jha, there's a new study finds, and you've seen it, that asymptomatic spread could be responsible for half of the coronavirus cases out there. The numbers are going up and up and up. So what does that tell you about how important it is to detect those silent infections?
Yeah, absolutely. If we're going to break the transmission chain, that's why we ask people to wear masks, even if they feel totally fine, because they could be asymptomatic spreaders. But that's why contact tracing is so important, because you can identify people who don't have symptoms, who may then go on to spread to other people. But if you can identify them and help them isolate, again, you can break these chains of transmission. This is Public Health 101. We've known about these things for hundreds of years. We just have to implement them in the United States.
Yeah, easier said than done. They're clearly not being implemented. Dr. Ashish Jha, thank you so much for joining us. Dr. Chris Murray, thanks to you as well. Thanks to both of you for the important work that you're doing. Appreciate it very much.